Vaginal yeast infections, also called yeast vaginitis or vaginal candidiasis, are a common problem. It usually occurs in frequent episodes, but can recur frequently and may cause chronic persistent symptoms. Yeast infections occur mainly in women who are having monthly periods, are less common in postmenopausal women who do not use estrogen-containing hormone therapy, and they are rare in girls who have not yet started menstruating. The most common symptoms include itching or irritation of the vulva and around the vaginal opening, pain with urination or intercourse, reddened and swollen vulvar and vaginal tissues. Some have no abnormal vaginal discharge. Others have white clumpy, curd-like, or watery vaginal discharge. Symptoms of a yeast infection are similar to a number of other conditions, including bacterial vaginosis or bacterial infection of the vagina, trichomoniasis, a sexually transmitted infection, and dermatitis, or irritated skin. It is often not possible to know if itching is caused by yeast or other causes. A vaginal yeast infection is caused by too many yeast cells in the vagina. The fungus Candida lives in the GI tract and sometimes the vagina. Normally, Candida causes no symptoms. However, when there are changes in the environment of the GI tract and vagina, which may be caused by medicines, injury, or stress to the immune system, Candida can overgrow and cause symptoms. Some medicines can increase your risk of getting a yeast infection, including antibiotics, birth control pills, hormones, and steroids. Contraceptive devices such as vaginal sponges, diaphragms, and IUD may increase the risk of yeast infections. You may also be more likely to get a yeast infection if you are pregnant, have diabetes, have a weakened immune system, or wear tight clothes. With treatment, most yeast infections get better in 2 to 3 days. Vaginal yeast infections are not a sexually transmitted infection. Call your doctor if you think you are having a problem with your medicine. Ask your doctor about over-the-counter medicines for yeast infections. They may cost less than prescription medicines. Do not use tampons while using a vaginal cream or suppository. Use pads instead. Wear loose cotton clothing. Do not wear nylon or other fabric that holds body heat and moisture close to the skin. Try sleeping without underwear. Do not scratch. Relieve itching with a cold pack or a cool bath. Do not wash your vaginal area more than once a day. Use plain water or a mild, unscented soap. Air dry the vaginal area. Change out of wet swimsuits after swimming. Do not have sex until you have finished your treatment. Thank you for listening. Subscribe to Diseases Simplified for more health tips and updates.